Doc, I'm pregnant and I need to travel. So is it safe? When can I travel? And are there any precautions that I can take? Hello and welcome back to Gynofit Living. I'm Dr. Riddhi Shah, obstetrician and gynaecologist. And today we have an important topic to discuss, especially for our expecting mothers out there. Travel during pregnancy. Whether you want to go on a vacation, you're planning your baby moon, or you need to travel for work, I've got you covered with tips and precautions if you want to travel while you're pregnant. So the first question I'm going to answer is it safe to travel during pregnant? The answer is yes, but subject to your doctor's approval. Your doctor will help you to determine whether you are in good health, whether your pregnancy is progressing normally, and is it safe for you to travel. So make sure you talk to your doctor before planning any trip, because every pregnancy is different and there are some conditions in which travel is not advisable. So what are those red flags, or which are those conditions in pregnancy where travel is not advisable? Number 1, previous miscarriages or bleeding during the current pregnancy. So if you've had vaginal bleeding during the first 3 months of pregnancy, that is the first trimester, usually we do a sonography to see whether the baby is okay, where is the bleed coming from, and is it any cause for concern. Accordingly, your doctor will advise you whether you need bed rest or you can continue your daily activities. So according to the case, the doctor will advise you how to take care of yourself. But if you are currently having bleeding, it is not safe to travel. Next is if you've had preterm labor in your previous pregnancies or in your current pregnancy. So if your labor pain started and you went into labor before 37 weeks in your previous pregnancy, or in the current pregnancy if you've had previous labor pains, then it is not advisable to plan travel. If you have leaked or your water bag has burst, even if this means it happened some time back and now the leak has stopped, you should avoid all travel except going to your doctor, of course. If you are pregnant with twins, so twins is already considered a high-risk pregnancy. So if you're pregnant with twins or you're having multiple pregnancy, it is recommended that you keep your travel plans to a bare minimum. If your doctor has told you that you have a low-lying placenta, so this puts you at an additional risk of bleeding during pregnancy. And if you have this condition, it is best to avoid travel. Next is if you have certain heart conditions, high blood pressure or preeclampsia in the current pregnancy or in the previous pregnancy. If you have a history of DVT or blood clots, it is not safe to go on a long journey. So the next question is, what is the safest time to travel during the pregnancy? The best time is the second trimester, that is from week 13 to week 26. This is because by this time your nausea vomiting must have disappeared and there is less chance that you might end up in emergencies like preterm labor or other such. The risk of miscarriage is also higher during the first 3 months of pregnancy. And many women find travel during the last few months of pregnancy very tiring and uncomfortable. So mostly you should prefer the time between 4 to 6 months to plan travel. So what are the safety precautions that you can take? First is prefer short trips as they are more manageable. Avoid long flights and avoid long road trips. Make sure you pack all the necessary items. Make sure you pack your prenatal vitamins, any other medicines prescribed by your doctor, your medical records, your files, and all other things that you would need just in case you land up in an emergency. Get all your pending investigations and blood tests done, any pending sonography is done before you travel. During your trip, being comfortable is the key. Make sure you wear comfortable clothes, comfortable shoes, avoid wearing heels, avoid carrying heavy hand luggage. Stay away from areas with high risk of infection. And while going in public transport or in crowded places, make sure you wear your mask. If you're in a car, always wear your seatbelt. And if you're traveling by flight, use the safety belt whenever indicated. Remember to stay hydrated and take breaks if you're on a long journey. Don't postpone your trips to the bathroom. Go as soon as you feel the urge and avoid constipation. Take regular breaks, as if you postpone going to the washroom, you can attract urinary tract infection as well. Take care to avoid stomach infections and traveler's diarrhea, as some of the medications which are used to treat them are not safe during pregnancy. So take all your precautions, carry a bottled water, and eat hygienic food. Wherever you are visiting, always know the name of the local gynecologist who can be there for you. Locate your nearest hospital where you can go just in case of an emergency. Before you leave, it's always a good idea to get a health checkup done by a gynecologist who can confirm your due date, check whether you are up to date on your vaccinations, and also he'll tell you the symptoms to watch out for while you're traveling. So travel can be by car, flight, or train, and I'm going to give you specific tips for traveling through each of these. So the first is travel by flight. If you're flying, make sure you check with the airline about their policies regarding pregnant passengers. Most of the airlines, after your 28 weeks, they'll ask you for a doctor's certificate saying that you have no high risk during this pregnancy and also confirming your due date. After your 37 weeks, most of the airlines will not let you to travel because there is a high chance of you going into labor. So make sure you check the policies before you plan your trip. Also, it is difficult to get travel insurance at this point in pregnancy. If you have twin pregnancy, which is uncomplicated, it is safest to fly before 32 weeks. So here are some friendly tips for flying during pregnancy. Make sure you take a seat at the front of the plane so that you have more leg space and also there is less impact during turbulence. Take an aisle seat so that you can walk around freely, go to the washroom frequently without disturbing other passengers. Use a rolling suitcase so that you don't have to lift heavy luggage. If you don't have a bag with wheels, pregnancy is a great excuse to find one. Always ask for help from your partner or from the airport personnel to lift your luggage, to put it in the overhead bin or in the car trunk. You can also request a wheelchair or an electric cart at the airport if you're rushing to make a connection or if you're feeling tired. Keep yourself hydrated, keep sipping on water. On your flight, avoid Coke, Pepsi, and other carbonated drinks. Avoid pre-packed raw salads as they could be contaminated with bacteria and they could make you sick. Also avoid beans, cabbage, cauliflower, dairy products as they can cause gas and they can make you uncomfortable during the flight. If you're on a plane and your belt doesn't fit, don't hesitate to ask the attendant for a seat belt extender. Don't be shy or feel embarrassed because you're just protecting yourself and your baby. Always wear comfortable clothes and comfy shoes. Also, it's safe to use the seat belt on the plane, so wear it whenever it is announced. Scanners at the airport are usually safe for mother and the baby. Also, the air cabins are usually well pressurized, so there is no need to worry. If you have a straightforward pregnancy and you're healthy, there is no evidence to suggest that changes in the air pressure and humidity will harm you or your baby. Also, there is no evidence to suggest that flying can cause miscarriage or early labor or your water to break. So you don't need to worry about all these. So during pregnancy, your blood tends to clot faster, putting you at risk of something called deep vein thrombosis, which is basically a blood clot, which usually starts in the leg, and if it travels to the lungs, it can cause breathing problems and other such emergencies. So, during your travel, try not to sit for long hours. Avoid traveling for more than 4 hours at a stretch. Take breaks in between. Stand up and walk every 30 minutes and keep moving your toes and your feet. Next is train travel. So, if you want to travel more than 6 hours, travel by train is your best option. Again, remember to stay well hydrated, keep snacking on food, and keep moving every half an hour. Choose the lower berth for you instead of the middle and the upper berth if you are in the sleeper coach. Also, if you're traveling by local train, avoid the super rush hours where it is jam-packed and you may need to stand for a long time. Also, you can always claim the dependent seats for yourself. Car travel. Always make sure that you wear your seatbelt and don't travel for long road trips more than 6 hours. Wear your seatbelt without fail even if you are in the back seat. Buckle the seatbelt under your belly and the upper strap should go in between your breasts. Always keep the airbags on as the safety benefits of the airbags will always outweigh the potential risk to you and your baby. Carry your medicines to avoid nausea and vomiting and keep taking breaks in between and stretch your legs. Keep snacking, drink plenty of water Always move your seat away from the dashboard, pull it behind so that you have more space and you're more comfortable. Lastly, don't travel solo, always travel with someone. Can you drive during pregnancy? Yes, you can drive during pregnancy, given that you are a good driver. Always wear your seat belt, take your seat behind so that you can accommodate your belly, and make sure that your feet are reaching the brake and accelerator. Tilt the steering wheel upward toward your breastbone, away from your belly, and keep a 10-inch distance between your body and the wheel. Don't ever engage in distracted driving like texting, talking on your phone, turning on the GPS, tuning to radio stations, eating, drinking, and whatnot. Traveling by motorcycle or scooter or bike is not ideal during pregnancy, especially if you have hypertension, giddiness, or difficulty in walking or balancing. Then it is not safe for you to travel by motorcycle or bike. We all know that in a country like India, sometimes it is unavoidable. So here are some safety tips. Firstly, you should keep your legs on both sides of the seat, as in case of a jerk or a bump, you are less likely to fall. Also, always keep your chunni or dupatta in your bag so that it doesn't coil around your neck if you fall and it doesn't get in the wheel. Drive slowly, avoid potholes as much as possible. Smoothly glide over speed bumps and take it slow. Always follow your traffic routes. So travel by auto rickshaw is very common in India, but we all know that it does not have any seat belt or any safety measures taken. Also, the built-in material is quite flimsy. Not to mention, the auto rickshaw drivers are very reckless and they indulge in speed driving. So if you're pregnant and you can't avoid travel by rickshaw, it is best to inform the driver that you're pregnant and to drive slowly, gently, and follow the traffic rules. So when do you seek medical attention during your travel? Seek medical attention when you're having pain in your abdomen, you're having contractions, you're having vaginal bleeding, your water bag has burst, you're having severe headache, giddiness, severe vomiting, or if there is a swelling or pain in your leg. In conclusion, travel during pregnancy can be a safe and comfortable experience given that you take the necessary precautions and consult your doctor before you travel. Always pack wisely and prioritize your comfort and safety. Thank you for joining me on GynaFit Living. If you found this video helpful, be sure to give it a thumbs up and subscribe to my channel. Hit the notification bell so that you never miss an update. Safe travels and take care of yourself and your little one. I'll see you in my next video.